Hello, and thank you for joining us today for our webinar on creating a culture of mobility to improve care coordination and drive efficiency. We know your clinicians and care team members rely on mobile-friendly environments to provide the best care for their patients. Today, we will talk about solutions that support a mobile strategy that provides balance between convenience and security. My name is Brittany White, and I'm a part of the product marketing group here at Forward Advantage. I'll be the moderator of today's webinar. Our speaker today is Patricia Trum, Director of Sales for our Identity and Access Management team at Forward Advantage. She has over 20 years of EHR and healthcare IT experience, focusing most of her career on utilizing technology and best practices for clinical documentation improvement to drive adoption and positive outcomes. There are a lot of people on the line, so your phones are muted. If you have a question, please enter it into the question panel on your screen, and we will do our best to answer those questions at the end of the webinar. We will be recording this webinar and we'll send it out via email to the link. We will send out the link to this recording via email when it has concluded. Thank you for your time. And with that, I will pass it over to Patricia.
Thank you so much, Brittany. So thank you everyone for attending today. We're really excited to talk to you about creating a culture of mobility. So we're going to look at the agenda. We're going to talk about key drivers within creating a culture of mobility and why our customers want to do that. The challenges that are faced based upon that. And then we're going to really take a good look at how we're going to take that culture and able to move forward and the technology that's going to support that mobility strategy. Next slide, Brittany. Okay, so key drivers, why mobility? So I have had the privilege of working with my customers directly for many years in my career at their organization. And as we all know, our providers are already mobile. Our providers were mobile when we were using hard wires and when we were using modems in order to connect and F20 keyboards. Their caring for patients has not changed. It's evolved. But what has also evolved is the way that they need to document and how they document due to patient safety as well as federal and state mandates. Documentation of patient care is happening for the most part in near or real time. So we need to be able to provide an efficient way and ensure that we have the full clinical care team in communication as we're going forward with it. There's a huge desire with providers to bring in their own devices and to be able to only have to utilize one thing in order to get their care for their patients. And technology continues to leapfrog, and looking at those different emerging technologies only enables our providers to want more. Next slide. So what are the challenges? Because the drivers are really compelling. It's the right thing to do, and the challenges that we're facing when evaluating that mobile strategy are ensuring that the devices and the information are secure, that they're meeting HIPAA and all necessary regulatory requirements. You have to take a look at the infrastructure. Does your infrastructure have the support in order to be able to support that strategy? Technology is amazing, but it's also resource intensive. And if you don't have the appropriate bandwidth to support it, in many cases, it actually exacerbates an existing problem, or it may make people more frustrated. You need an adoption strategy based upon clinical workflow and buy-in. You need to be able to ensure that this is something that is going to be looked at as an executive clinical initiative, not just a technology initiative. And you also need to ensure you have the resources to make it happen. Next slide. Okay. So mobility brings powerful benefits for our clinicians, the healthcare organization itself, and our patients all alike. Ideally, your providers will be able to log into any workstation easily and securely and access a consistent desktop environment and session anywhere they go. They should no longer be tied to traditional desktops and computers on wheels. They can carry mobile devices on their rounds. They can also access clinical systems and be notified of vital patient data just as easily from beyond the hospital, even on their own personal laptops, smartphones, and tablets, to respond to their patients' needs, make fully informed decisions, prescribe medications, and relay instructions to hospital personnel. So that culture of mobility should provide our clinicians their workflow to care for their patients, while the technology is going to complement, and it should be less forward-facing and a piece of the workflow puzzle. For this discussion, I'm going to focus on provider mobility and those technologies and services, but I also want to briefly address a challenge that we do face of patient identification, and that's actually why you see it here as that first step. So we're going to take a look at this in terms of the workflow. In our increasing digital world, not only are providers mobile, but we also know that our patients are going to be in different places within our community because you are a community of healthcare taking care of those patients. So ensuring that you have that right patient right from the start is critical. The national average rate for errors for misidentification is approximately 10%, and 6% of the misidentification errors actually lead to a medical error. So I wanted to let you know if positive patient identification is something that you would be interested in learning more about. We're doing a webinar on that on October 25th, and it's called Patient Safety and Registration Accuracy through Biometric Patient Identification. And we'll actually show that at the end of this presentation as well, so that you can note that. Next slide, Brittany. So with the culture of mobility, it's really important that it's user-centric. So looking at your providers, whether you're a physician, a nurse, therapist, case manager, the solutions that need to be provided, because there are so many different ones, need to be able to focus on the user. So that user needs to be able to get to the information they need or receive the information they need. It needs to be seamless, it needs to be timely, it needs to be automated in most cases where it can be, and it needs to be intelligent. So that provider, you want them to be right in the middle as you're looking at your mobile strategy and the opportunities that exist for them. Next slide. So we talked about the ideal workflow and what that would look like with our providers having access to their information from anywhere at any time from any device. So how do we look at that from a technology perspective? What we're looking at here and what we'll be talking about in a little bit more detail are some of the pieces of that puzzle. So virtualization, single sign-on with authentication management, as well as identity, strong identity management. Next slide. So let's take a look at that piece where we're looking at our providers accessing that information from any desktop or any type of device at any time. First piece is looking at virtual desktop. Virtualization gives our providers access to MEDITECH and other applications from any of their endpoint devices with unparalleled reliability. So features in the background, which they're not going to be able to see, but that from the IT perspective are truly important, is having features that are in the background to continuously monitor, load balance, and dynamically allocate resources across the desktop environment. So that's going to give our IT teams the ability to deliver a non-stop point-of-care desktop with all applications and data readily accessible. Now, I had mentioned earlier as a part of the challenges is really understanding your infrastructure, and the health and your bandwidth of your virtual infrastructure play a significant factor here. So at Ford Advantage, we have a team of engineers that are certified in virtualization with Vue, and we have experience with Centric. We're able to provide assessments of the health of your infrastructure, as well as provide optimization and remediation services. We've also recently partnered with VMware as a healthcare solution provider, so we are now able to provide the view technology as well as the services to assist our customers. And if you're interested, if you have VDI and you're looking to either optimize or to understand a little bit more about how you can bring providers in a VDI scenario, we're having a webinar on August 31st that will be called Making the End User Experience Personal with VDI for a deeper dive. Next slide. Okay, so now we have our providers. They are able to have the experience of having that one desktop to be able to follow them throughout your organization. They can access it from anywhere. So another piece of that puzzle is single sign-on. It can help you in terms of optimizing your clinical workflows. An example would be if I'm a specialist, I can run easily across devices and facilities at my office throughout my day. I can authenticate and have access to all of the solutions, applications, and information that I need to care for my patients. Conservatively, time studies have shown that a single sign-on solution such as Imprivata OneSign can save clinicians up to 15 minutes per shift. Based upon your infrastructure and mobility strategy, OneSign will be able to enable you with a multitude of authentication choices to be able to tap onto the system, authenticate with your password, traditionally your Active Directory password, and then be able to seamlessly get from one solution to another throughout your day. Next slide. So now that we have our providers on any device anywhere, and they're using OneSign to be able to sign on, the next challenge that comes up is security. So individuals that have remote access and are accessing that system traditionally have access to the most sensitive and vulnerable information within your system. So we think physicians for caring for their patients and placing orders, IT has an architect analyst have access to sensitive information as well. We know that healthcare organizations are attractive targets because they have both health and financial information. And based upon the 2015 HIM cybersecurity survey, it showed that phishing and similar attacks are a #1 threat. So, according to the annual Congress report from the Federal Information Security Management Act in February of 2015, it was noted that 65% of cybersecurity incidences could have been prevented with multi-factor authentication. So we want our providers to be able to get to their information, but we also want to ensure that our providers are who they are when they're accessing. So we bring in Confirm ID remote access, and it's going to enable you to authenticate from a mobile device with a press of a simple button. You can see the image here. It's very user-friendly in terms of being able to just swipe to approve. But when you're accessing your system, you would be able to put in your user and your password as you would traditionally do, and then we would be able to send you a push notification in order to be able to authenticate, so a two-factor authentication that you are, and it will get passed through the system, and then it will be able to, you'll be able to have access to all that you need. Imprivata Remote Access does integrate with VPNs and remote access gateways from leading providers that include Centric, Cisco, VMware. And Imprivata Confirm ID for remote access also supports any additional gateways able to connect via radius for authentication. Next slide. Okay. So next we're going to talk about communication. So communicating information securely from anywhere at any time. Care coordination, how do I ensure that we're getting all of that information, we are getting it onto a secure platform, and that we are protecting ourselves? So what we're going to do is we're going to take a look now at our secure messaging solution, and it will be on the next slide. Brittany, can I have the next slide? Thank you so much. Okay, So we call it a secure messaging platform because it is more than just texting. Providers today in time, one of the top challenges that we hear is about insecure texting, which is a big no-no. We know that that is something that for HIPAA violations can cause a tremendous stress and burden on our customers today. So we have our secure messaging platform that is going to be able to provide, it's a cloud-based SaaS solution. It's hosted in the Amazon cloud. It's HIPAA compliant with end-to-end encryption, meaning data is secure at both rest and in transit, and it's exclusively endorsed by the AHA. It's recognized for assisting healthcare organizations achieve operational excellence, and it gives immediate access to providers and care teams for all types of communication. You can see that it's not only messaging, but that you're able to have image sharing. You're able to, because it is user-based, it's not focused on devices, but on the user. So one of the challenges that a lot of customers have is, I don't know this provider's phone number. How do I get access to this particular individual? And so the ability to know that this is all user-based is that you can go ahead and set up individual or group messaging. Most of our organizations have, you're not just one entity. You may have multiple entities or practices, the ability to have multi-site communication and real-time sync on your multiple devices. Also alerting to ensure that you're receiving the escalation notifications of when you need to, when you're trying to be notified. It also has a broadcast messaging feature. So if you have a program for your codes or for other types of warnings in place, being able to utilize one system in order to communicate that information to all of your providers is available as well. And last but certainly not least, and what we'll focus on for the next couple of minutes, is the partner API. So I had mentioned earlier that we work with Imprivata, and we are a MEDITECH co-development partner as well. And so we were able to leverage the ability to integrate with the MEDITECH system and work with Imprivata to create the Cortext connector. Next slide. So the Cortext connector is built on, and many of you are a customer of ours for report distribution and would probably recognize what we're looking at here. But with Communication Director as our report distribution platform, we created a methodology in order to be able to utilize secure message notifications as one of our routes. So our providers are receiving information from all different types of areas. They want to get it at different times. I may want an email, Brittany may want it faxed, but also when I have a patient that's admitted into the hospital or has been discharged from the emergency department, I also need to be notified of that. And I don't want to rely on the fact that I need to have a discharge summary or that that information may get to me in a different way. So in comes the Cortext connector. Next slide. The Cortext connector is going to be able to leverage Communication Director and the reporting that is behind the scenes within MEDITECH. So I had mentioned transitions of care for admits and discharge, for instance. What we do is we work with our customers to be able to pull out the pertinent PHI information that you would want to see on a notification from a discharge notification, for example, or in this example, a critical lab result, and pull out the information that you would want to see in that notification in order to ensure that the most immediate and accurate and clinically significant information is presented to the clinician at the time they receive that notification via their secure messaging. Next slide. Okay, so this is a little bit of a workflow as we're going to look at a MEDITECH screen. So that patient is going to be discharged, as we had talked about earlier. Now, another challenge that we hear about is from our customers' perspective is there going to have to be another process that we need to implement in order to do this. Because as we know, as we continue to layer processes on, that they tend to get left behind. And if they're left behind, critical information can be missed. So what we're looking at here, for instance, is a MEDITECH client server screen. I'm in the discharge routine, and I'm discharging the patient. When that happens, in the background, a report is generated standardly. Go ahead and hit the next enter button, Brittany. And so what's going to happen is that with the workflow that exists for that staff member in time who is discharging that patient, that information is going to be securely sent to our communication director and go directly through our Cortext so that we are able to provide that secure notification. Can you hit it one more time, Brittany? To receive that notification. So we are not changing the workflow of providers. Your providers will be able to order. Your support staff is going to be able to take care of their patients, whether registering or discharging them, and we're going to be able to call that information out and prepare that notification when it is necessary for those providers. Next slide. We wanted to show you a few of the use cases for the connector based upon working with our customers to date. So what we had found was transitions of care because of looking at population health and the readmission rates, being able to notify providers in order to be able to ensure that their patients are following up and managing their care is significant. So the ability to look at being able to reduce those readmission rates by having that notification go off within its appropriate time before the 72-hour mark would be critical. Also, we have had customers that wanted to ensure that their providers were notified with abnormal mammography results, critical labs. Another is consult requests. So whether I'm a specialist or I'm a respiratory therapist or in PT, I'm usually not sitting at a desk. I'm taking care of a patient, or I may be in another area within the organization or out in the community. The ability to see that when an order is placed for that type of request, directly onto my preferred mobile device and not have to go into a system such as the MEDITECH system to look at my work list and have that pertinent information such as the patient's room, their name, their diagnosis is significant in terms of assisting with productivity. I had mentioned earlier that you are leveraging the Communication Director platform, and so the intelligence that's built into that is ensuring that the right information is going to get to the right person at the right time. Because as a provider, I may want that critical lab result in real time, but if I'm going to know that my patient was admitted into the hospital, I may want to see that tomorrow at 8 a.m. if it's already midnight. Next slide. Okay. So now we're going to talk about printing and the challenge around secure printing, and if you're already utilizing a virtual environment, how you may be affected by your providers starting in one area and then moving to the next. And the system actually thinks that that provider is back on the first floor that they were at. So many of our customers have come to us to talk about, in terms of keeping and managing their print drivers, that they have too many to manage, that they have printing challenges associated with BDI, as I had just mentioned, and then also there are security concerns related to HIPAA violations with unsecure printing. So thinking about just that example of if I printed a prescription or a discharge instruction to the wrong printer and somebody was able to pick that up, that would be a tremendous challenge. Next slide. So in comes Uniprint Infinity. This is a virtual printing solution that is PDF-based, and it's a universal print driver. It is for any computing environment, and it has a centralized management solution. It enables pull printing across different platforms as well as remote offices. It has location awareness. We created with Uniprint and MEDITECH the ability to be able to recognize for foreground printing for our client server and 6X customers that it will know when that provider is at their particular floor to be able to show them the printers that are where they are, and it will send it to that bridge server and it will print it to the appropriate printer. Next slide. So what we've taken a look at in terms of mobility and creating that culture is looking at the ideal workflow from accessing the system from anywhere to ensuring that I'm able to communicate and receive critical patient notification or data from anywhere I am, and also to ensure that if I do need to do any type of printing, that I'm doing it securely and that it is manageable by my IT organization. So at Forward Advantage, if you're a current customer of ours, you know that we've been a MEDITECH partner for over 20 years, and our expertise in the MEDITECH environment is based upon our experience with working with you and working with MEDITECH, understanding the pieces that will assist in ensuring that the workflow within the MEDITECH system is working optimally for your providers. We do have preferred pricing, and our high level of service is always something for everyone who knows Lee Howard. He can sing and dance, and he also ensures that his implementation and support team are at the highest level and ensure that they are providing that service to you. And as I had mentioned as well, our solutions are tested and developed with MEDITECH, and we continue to work with our customers and MEDITECH where there are challenges and gaps to ensure that if that we are creating a solution or we are working with partners that are going to provide the optimal solution for you. Next slide. So I want to thank you, and I'm going to turn it over to Brittany for a moment. But I had mentioned a couple of our webinars that are coming up in the next few months. So I wanted to make sure that you had a moment to be able to look at them and to ensure that if you're looking at your schedule and different opportunities, that you are able to go ahead and register for those as well. And now I'm going to turn it back over to Brittany.
Thank you, Patricia. I hope this session has given you a better understanding of how Forward Advantage can help to create a culture that embraces mobility for your organization. Now, we do have some time for questions, and we have quite a few, so we'll do our best to get through them. If your question doesn't get answered, we will follow up with a response individually after the webinar. So, Patricia, the first question that came through is, we currently have challenges with providers printing in our virtual environment when they move from one care area to another. How does your printing solution resolve that?
Great question. Thank you for that. So there are two pieces that address it. For Uniprint, you have the universal print queue. So you're going to be able to have your print jobs go directly to that print queue, and it's going to be able to delegate where that print job goes. If you're using secure printing, you'll be able to, as a provider, securely pull that print job forward to the printer that is designated that you are at. If you're a client server and 6X customer, as I had mentioned earlier, location awareness has been an issue in the past. So we have our Smart Print option that will also be able to map the appropriate printers to the provider where they're at to ensure that that documentation is printed to the right printer.
Thank you, Patricia. Another question I have is the information for Cortext and automated notifications auditable?
Yes, yes it is. So as I had mentioned when we were talking about Cortext, it is stored in the Amazon cloud, and it is fully auditable. There's administrative tools that will allow the providers, it's stored up to 1 year in the cloud, and you're able to bring that information down, and you're able to archive it appropriately, as well as with our automated notifications with our communication director that has a full audit trail as well.
Thank you. Next question is, what if a user does not have the push token functionality available? I think it's related to Confirm ID.
Yes. So Confirm ID for remote access, great question. So some provider, if they're not using that push token, or you don't want to have that push token functionality available, it does support additional authentication methods, such as conventional software tokens and SMS. That'll help increase your flexibility as you're looking at your different requirements for your various user authentication workflows.
Thank you again, Patricia. Okay, as we do want to respect your time today, for those of you who didn't get your questions answered, we will follow up with a response in the next day or so. And as I mentioned before, we are recording today's webinar, and we'll send the link to the recording to share with your colleagues. Thank you again for attending, and please follow up with your dedicated sales team for any additional questions. This concludes the webinar.